Welcome back, runners. I'm going to talk to you today about how Strava can impact on you getting knee pain. Now, if you're a runner and you've had knee pain in the past, you know how frustrating it is when it stops you from being able to enjoy running. And I'm going to talk to you today about 3 top reasons why Strava can be unhealthy for certain people. So I'm going to start by introducing the number one cause of running injuries. And it's not heel striking, not stretching, running on concrete. All the myths and all the reasons that people think are the reason running injuries exist are not the number one cause. The number one cause is a training error. Now, this is where the maximum amount your knee can tolerate has been exceeded in terms of the amount of running that you've been doing. So your knees can tolerate a certain number of steps and a certain amount of running. Let's say it's 15k per week, and you do 30k one week. That's going to surpass what your knee can tolerate in that moment and lead to tissue damage and an injury. And this could be a kind of sudden type of injury, or more often it's over a period of time. It's an overuse injury where that you just incrementally each week doing a little bit more than the knee can tolerate, and then it gets to a point where it hurts so much that you have to rein back your running, or you can't run as far as you used to be able to. So how does Strava impact on knee pain, and how can Strava cause knee pain? Well, I looked at a study recently and it looked at 18 runners, and one of the number one things that they identified from using Strava was self-presentation. So this can be a good thing and it can be a bad thing. Self-presentation reflected how patients or people felt about how much they were running. So a lot of the people they interviewed said they would run more than they would want to, because then doing less than 5k didn't really feel like a proper run. Or people who were running really, really slowly because they were coming back from an injury felt like they had to explain why they were running so slowly to their peers. But on the flip side, there were some good parts to it. So out of all the social media platforms, they identified that Strava was the one where you could be the most honest and say, hard run today, legs didn't have it. So that there were good parts and bad parts, but the way in which Strava in this instance could cause or lead to an injury is where you're increasing how much you're doing in terms of running to a point where it's more than the knee can tolerate, just so that you can look good. And obviously that's not everyone, but there's a certain subset of people that could do that and could lead to a training error, which could lead to a knee injury. The second thing that people found was social comparison was a big part of using Strava. Now, again, it can be, there's a saying, comparison is the thief of joy, but it also can be motivating as well. So there's a healthy level of competition that exists, which might push you and might keep you on the app and keep you running, which is a good thing. But obviously there are extremes where, I would say that bigger distances are normalized and running fast is normalized. So you see your friends doing way more than you, and it can start to make you do more than, again, the knee can tolerate, and potentially you could make a training error. So I think that's something else that they gathered from this study. The third thing they looked at was that, like I've said just a moment ago, is that it can be a huge tool for motivation. So tracking your progress and seeing it visually over a period of weeks and months and seeing how you're getting better is a really, really motivating part of Strava. So they talked about the self-determination theory, where there's 3 components. There's autonomy, belongingness, which again is what Strava brings. You feel like you're part of the community, and it feels like you're kind of almost doing your runs with your running club or your running friends. And the third one was competency. So if you've got all of those 3 things, then you become very self-determined. And if you're seeing your progress and you're seeing yourself get better, then you're more likely to stick at it. So again, I would say that's a good thing. And again, there are examples where your motivation may be so high that you could just carry on running and feel like you need to run every day to keep up with everyone else and to see yourself continuing to get better. And I've done it before when I was trying to get a sub 20-minute 5K. I mean, this was when I was very inexperienced, but I used to go out and just try and do a sub 20-minute 5K every time I went out, which is stupid. But motivation was high, which is good, but you know, and I was trying to be more competent and trying to improve, but I didn't get injured on that during that period of time. But it was definitely reckless, would have put me in that kind of definitely raised risk of hurting myself. So there's two more main points that I wanted to relate. You know, how Strava can impact on your knee as well, and one of them is anxiety and stress. So all of the things I've just talked about in terms of Strava and what effect it can have could impact on someone's anxiety and stress. So if every time you look at your app, you see your friend doing better than you don't see you making progress, and you almost have this guilt when you don't run, they're all quite negative emotions. And negative emotions, stress and anxiety, can slow down your recovery as well. So if it's extreme and potentially you're already quite anxious anyway, and you have a stressful job and this is adding more stress, this could again slow down your recovery after each run, which again could lead to you hurting yourself and your knee becoming injured as well. The second thing is it normalizes, like I said before, big distances. So when you do couch to 5K, you realize how slowly they incrementally increase people's running, and that's because your body takes quite a lot of time to adapt to running. But someone who's brand new to running, for example in January or in COVID, when there was a 46% increase in downloads for fitness apps, and because of the limits on how much we could go out each day, and again the comparison, people were running way more than normal. And I was tracking Google searches for knee pain, and they doubled during that time. So what we can conclude from that is that, again, looking over your shoulder and looking at other people can lead to you doing too much and almost reaching too far in terms of what you can see your other friends doing and what you think you should be doing, which again can lead to a training error, which can lead to a knee injury. So in conclusion, I would say Strava brings more good than bad, but there are instances and subsets of people that it can be harmful because of the factors that I've talked about. Look at your relationship with Strava and think, is this net positive or net negative? If you're constantly getting injured and you constantly are in pain and you're constantly having to stop running because you're hurting yourself, could Strava be part of that? Are you overtraining because you feel like you should be competing with your friends, or you feel like you should be making progress? And could you delete the app for a period of time and just see what effect that has? And secondly, stick to your plan. Strava has a tendency, with all the medals that you can get and all the splits, to provoke you into doing things that aren't part of your plan. So if you've got a marathon, then these splits where you can get medals and be the best of the day are totally irrelevant to you, and you should be completely ignoring them because they're not going to be productive and they're not part of your plan. So it's important to think about what your plan is and stick to that as best you can, and use Strava for what it is good for, which is being part of a community, making progress. Thanks for watching. If you have any questions, then leave them in the comments box or send me an email at hello@instantphysio.co.uk. Thanks for watching.